so personally. So now moving into individual outcomes of training the mind. I'm just talking about ones that are particularly relevant to sitting with clients. Executive functioning being one, and I'm just providing an overview. By no means is this a comprehensive review or literature review of outcomes. I'm just providing a few examples. But cognitive flexibility, as measured by less Stroop interference. So here's a graph by Moore and Malinowski. On the x-axis, we'd have global mindfulness functioning, as measured by the Kims, and non-meditators as the black dots, meditators as the white squares. And we can see that meditation is not only associated with increased mindfulness, but also with less Stroop interference, less Stroop errors. And also Sarah Lazar and colleagues found midline prefrontal regions, actual structural changes in the brain, thicker cortex in these areas associated with training the mind. And they found actually dose response effects, so advanced meditators who had meditated more actually had a thicker cortex. And self-regulation as well. Tang and Posner found that self-regulation was improved both in the short term and the long term due to attention training. And I like this definition of meditation as a synthesis between East and West here, and this is by Kahn and Polish, that practices that self-regulate the body and mind. So we can see how practicing self-regulating the body and mind would promote self-regulation as a trait. Also, improved attention. So mind training, training the mind, modifies subsystems of attention, distribution of attentional resources, and sustaining attention over time. Again, Moore and Malinowski, again on the x-axis is the Kims, and on the y-axis this time is the D2 concentration test scores. So the ability to sustain focus over time, also correlated with meditation and mindfulness. And I just mentioned a few studies here about attention. There's a lot. But just to show that meditation and mindfulness impact all three major functions of attention, alerting, orienting, and executive attention. Positive emotions. Barbara Fredrickson at the University of North Carolina, Chapel Hill, found that loving-kindness meditation increased people's frequency of positive emotion. The authors concluded that the broadened outlooks resulting from positive emotion facilitated the behaviors which subsequently led to consequential personal resources. And in addition to loving-kindness practices, other practices of Buddhist methods of training the mind have been associated with positive emotion, Zen and MBSR being two. And so positive emotion, the increase in frequency of positive emotion and also intensity have been shown to be outcomes of training the mind, or associated with mindfulness at least. Empathy and compassion, now moving more towards what I'm calling the second turning bit. But again, individual studies on the individual effects, what's happening within the individual who's practicing. Lutz and colleagues found that advanced practitioners, compassion meditation could self-induce high amplitude gamma synchrony, so whole cortex brainwave synchrony. And also a positive correlation between self-reported mindfulness and empathic concern in undergraduate students. And then this is the one that is most interesting to me, at least, and to our presentation. Lutz and colleagues found greater activations in long-term meditators versus novices in areas of the brain previously linked to empathy upon hearing affect-laden sounds, such as a person in distress or a baby laughing or something. So it seems like, and this is a bit of a reverse inference, but it seems like these meditators and being in the meditation state actually makes one more empathic. And Lutz and colleagues go on to conclude these findings suggest that cultivating the intent to be compassionate and kind can enhance empathic responses to social stimuli. So just to emphasize the role of intention here in their work. So how can these variables at the individual level and these outcomes of training the mind influence therapeutic alliance? Well, attention, positive emotion, and synchrony or coordination were the three variables found to contribute to good rapport, positive rapport. And these researchers say that these these three variables interrelate to form a dynamic process of rapport with different weightings of the importance of these corresponding to different times in the relationship. And so this is just an oversimplified version of what they found, but attention being primary throughout, and positivity, the experience of shared positive emotion, being more important at the outset, and synchrony and coordination being more important later on down the road. So this is just one way in which these variables, these outcomes of training the mind might interact. So alone we can imagine that empathy would promote positive relationship, but they might interact as well to promote therapeutic alliance. So while not an exclusive focus of training the mind in Buddhism, certainly these practices influence our capacity and improve our capacity even to be of service, to have superior interpersonal functioning, to be of service to others in close connection. So as opposed to being an activity of isolation, mind training actually brings us into greater connection with others and with the world. As Siegel writes, mindfulness skills may greatly enhance this capacity for interpersonal resonance by simultaneously building our resonance circuitry for enhanced compassion and empathy, and our prefrontal self-regulatory circuits. The result would be the greater ability to stay open with others, even in the face of their distress. So I'll talk about this latter point in just a moment. But again, just to emphasize that these practices, we often think of them as practices that we're doing for ourselves, but they seem to have effects and influence on variables that promote superior interpersonal functioning. So here's some studies that have been done. Mindfulness and interpersonal behavior, moving into the improvements associated with mindfulness in interpersonal behavior. And so in this latter section, I'll be moving from more gross levels in which mindfulness might influence interpersonal behavior to more subtle levels in which the therapist's own mindful presence might influence the client. So all elements of the KIMS were correlated with expressing oneself in social situations. Mindful observation was correlated with more engagement and empathy. And these other three subscales of the KIMS were associated with less social anxiety. And this one's particularly important to us as clinicians, is less distress contagion, experiencing our own distress in the face of the distress of another. And considering that burnout is a common problem and contributes, I'll mention some research later on, contributes to poor patient care and quality of care, this latter point is particularly important. Also, Fredrickson, in the same study, found that the positive emotion cultivated from loving kindness meditation resulted in improved and positive relations with others. And this experience of positive emotion has been linked to increases in people's feeling of connection. Now, I know it says oneness here, and I don't think we're talking about enmeshment or something like that. What we're really talking about is more this experience of deep intimacy with another while still maintaining oneself, similar to research done on empathy. And also greater trust in acquaintances and reduced racial bias. So all three of these things would be important to us as clinicians. MBSR and students. Shapiro has done a lot of work on this. Shapiro found that medical school students in MBSR programs showed increases in empathy over time. Self-compassion increased with the MBSR program, which we can imagine touching into one's own pain and having compassion for that might help us be compassionate towards others suffering as well. There was also less job burnout in the MBSR group in this later study, but these decreases were not statistically significant, but it was a small n in the